I want to admit publicly on this show that I do not know what the word means. Every time people say it, I smile and nod. I don't really know the definition. Welcome once again to Free Associations from the Boston University School of Public Health, the Public Health and Medical Journal Club podcast for anyone who is as confused by the latest health study as I am by denominators. So have you both been following all the conversations on social media about the number of people who are hospitalized or infected who have been vaccinated while they completely ignore the denominators that most people in these populations are completely vaccinated, and therefore you would expect lots of vaccinated people to be the ones getting sick as long as it's lower than the percentage vaccinated than the vaccine is doing. No, am I the only one who's following this?
Not only am I following it, I've had these debates with several people in my life who are anti-vaccination, anti-vaxxers.
Is it as hard? Are you finding it as hard to communicate as I am?
Yes. I mean, I can't say how you're feeling, but absolutely. I think I'm resigned to just asking people questions at this point instead of actually trying to give them opinion and let them talk themselves into a circle.
I think that is absolutely, I'm going to do that from now on. I appreciate that advice. Well, I am Matt Fox from the Departments of Epidemiology and Global Health at the Boston University School of Public Health, and I am extremely grateful to be joined by two fantastic guests today. So the first guest is Dr. Lori Dean from the Johns Hopkins Bloomberg School of Public Health. Welcome to the podcast, Lori.
Thanks for having me. Appreciate it.
So
I was waving, but I realize that no one can see me.
Waving does not come through as well on podcasts. Yeah. And our second guest is Dr. Dustin Duncan from the Columbia University Mailman School of Public Health. Welcome to the podcast, Dustin.
Thank you very much. I'm excited to be here as well.
And as a reminder, if you could head on over to the Population Health Exchange website at www.pophealthex.org. That's BU's hub for lifelong learning, where you'll find all kinds of interesting public health programs and tools. And also, if you can go onto your favorite podcast app like iTunes or Stitcher and give us a rating and tell us how much you love the show or any other feedback you want to give us, it always helps other people find the show. So let's get into it. So today in our first segment, which is our journal club, we're going to look at a study on the relationship between white privilege, social position, and health. Then in the second part of the podcast, which is our deep dive, we'll talk about why it's important to study neighborhoods and their impact on health. And then in our last segment, which is our amazing and amusing, we'll get into things that just interested us or made our day. So let's get into the first segment. And as I said, we'll talk about a study on the relationship between white privilege, social position, and health, published in Social Science and Medicine. And it was entitled An Empirical Analysis of White Privilege, Social Position, and Health by first author Naoyo Kwate from the Departments of Human Ecology and Africana Studies at Rutgers, the State University of New Jersey. So this is a bit of a deviation from our normal approach where we look at studies that have recently come out. This one was from 2014, but I did go back and there were some headlines for the study, so I'll just read you a couple. One was from Health Medicine Net, which says how racism impacts the health of people who suffer abuse, and the conversation headline was, does racism make us sick? So, Lori, can you start us off by talking us through what this study is? And before you do, I should just say, this study is in Social Science and Medicine, which I used to read quite a bit, and over the years have been reading less and less. And I have to say, going back to it, the way that articles are written in Social Science and Medicine is so different than a lot of the epi journals, and I really like it. So thank you to you both for reminding me of that. So yeah, Lori, if you could tell us what the study was about.
I agree with you, Matt. When I read this, it felt very, very refreshing to read this in this format and to have a journal that really gives the space to talk about the context and the setting and all of these other principles that we feel like are really important for epi. So I love this paper. And even though it was published back in 2014, I think it's actually very timely for today, right? We're having this national conversation about critical race theory and what that is and what it's not. And I feel like reading and thinking about this paper just made me feel like it could have been written last year, or it could have been written
So
even
true.
more recently. And I'm really excited. And one of the things I really loved about this paper was the boldness of these authors. Again, this was before people were talking about anti-Blackness. This was before people were talking about critical race theory. And I appreciate that they went in and they decided to try to measure white privilege. So yeah, before I get into the paper, I think it brings up two big questions for me, right? Is thinking about in EPI, we talk so much about measurement and the quality of measures, but how do we measure something that's very difficult to measure? How do we
Mm-hmm.
measure something that people might not want measured because it's politically coded? And some people don't even believe, for example, that privilege exists. Peggy McIntosh talks about privilege being an invisible backpack that people carry around. So how do you
Mm-hmm.
measure something that people don't even recognize is happening to them, right? If you don't realize that you're getting a better mortgage rate, for example, than your neighbor, or than the woman who has the house, or than the Black neighbor that you have. So how would you even measure something like that? And I appreciate that they really attempted to do that in this paper. One final note I'll say about the timeliness of this is that the NIH has its first ever RFA for structural racism due in just a few days. So as many people that are applying for this, hopefully are thinking about these papers and some of this work, this body of work that has been done. So this is still really timely even for today.
Mm-hmm.
All right. So what did this paper actually attempt to do? Well, one, it was based on a previous finding that they saw better health among white people in areas where the disparity between Black and whites was the widest. So they wanted to understand what exactly was happening and essentially had two ideas. The first idea that they called this hoarding idea, that in places where the Black and white health disparity gap was the widest, that maybe there was this hoarding by white persons to make sure that they had resources to guarantee that their better health. The other thing that they think about is whether or not there's some psychological relief that might happen for whites when they see Blacks doing worse than them. So essentially, that if you've achieved a certain level of health and particularly social standing, maybe that gives you a level of comfort about where you are, and that essentially you've arrived where, quote unquote, you're supposed to be at the top of the social hierarchy. And maybe that converts into some sort of health benefit or psychological benefit, and then thereby a health benefit. So they took advantage of some settings in the US where they felt like they could explore white privilege. And these are settings that are near and dear to, I think, all three of us. Matt, you're still in the Boston area. Dustin and I trained at Harvard School of Public Health. So reading through this paper just made me think about walking through those neighborhoods and the qualitative differences that you would see. And again, speaking to the credit of social science and medicine, they really gave them space to talk about the qualitative differences between these neighborhoods and how they've changed over time.
I learned so much just about Boston.
In reading this paper?
Yeah, I did.
So for those of you who know the geography of Boston, they looked at 3 different Boston neighborhoods, all of which were predominantly white. So those were Back Bay, South End, and Jamaica Plain. And essentially what they were trying to do is look at neighborhoods that were predominantly white, but then had a range of socioeconomic position even within those neighborhoods. So looking largely within one race, but then across various socio-demographic characteristics within those particular neighborhoods. Within each of those neighborhoods, they randomly selected households. I believe they selected 2,400 households to send surveys to. And those surveys asked all types of questions about the participants and that household's demographics, financial strain. They asked about subjective social status. So they used the MacArthur ladder, which is a popular method in social epi for a self-assessment of someone's social position relative to the rest of the population. And they additionally asked about someone's social position relative to the neighbors that they live near in their respective Boston neighborhood. They also asked about how welcome people of other races, and actually in this case, I think they only asked about Black neighbors, but they asked about how welcome Black neighbors would be. And then they assessed a couple of health outcomes, including self-rated health and dental health and happiness. I really appreciated that they thought about dental health. You don't hear about dental health, or I should say, I don't hear about dental health enough.
I don't either.
But it's an elective healthcare. And in many cases in other countries, people aren't doing the extent of dental health that we do. But even in the US, it's still a form of elective healthcare. And I do think dental health speaks somewhat to a level of privilege that people have, right? If you can afford the fancy headgear and the retainer and all of those things just to make your teeth straight, which, in some ways people would even consider cosmetic.
Yep.
Beyond potential health challenges associated, right? In many cases, it's considered elective. So they asked these questions of households in those neighborhoods. They said they had a response rate of about 38%, which they noted later as a limitation, but I felt like wasn't a limitation because if you look at, for example, other well-respected surveys like the California Health Interview Survey or even the Briefs, those range from anywhere between 25 to about 45%. So I felt like they actually had a pretty robust response rate for a population health survey. So what did they find when they looked at these associations? And again, essentially, they were looking at the responses of the respondents across the socioeconomic gradient within each of these neighborhoods. So the first thing they found is that they expected that neighborhood health would follow an inverse gradient. And they said they did not find that. In fact, they said that the data did not support that hypothesis. The second thing they found was that subjective measures of social status and social position were more strongly related to self-rated health and their other outcomes than objective measures. And the final thing that they found was that for white residents who lived in neighborhoods where they perceived other races as welcoming, those white residents tended to enjoy better health compared to those who lived in areas where they perceived that Black people were less welcome. And in the end, they offer a couple of thoughts about why they found what they found. So one thing they pointed out that was interesting was that despite the fact that people felt that in some of these neighborhoods, Black people were very welcome, Black people did not live in those neighborhoods. So it really belied what the truth was about those demographics, but felt that maybe perceiving that Black residents would otherwise be welcome actually made people think that they didn't have any white privilege, right? That there must be something else going on because Black people are welcome here. They just, for example, choose not to live here. Not that they're systemically or systematically kept out of my neighborhood. So maybe it took actually some relief of them of thinking that they don't have this white privilege that this study was attempting to measure. The other thing that they found was that, and this they found particularly in Jamaica Plain, that perceptions of Black welcome actually didn't confer the health benefits seen in the other two communities. So in the area of Jamaica Plain, which is the one that they considered the most, I say, working class or the most lowest socioeconomic position, they actually didn't have that finding, which again, they felt supported thinking about that there's not only white privilege happening, but there's even potentially a gradient in white privilege that's happening where neighbors that or neighborhoods that are very, very well off can see these privileges, but potentially that there's this interaction between privilege and socioeconomic position where the findings would be different. So in doing that, I really love that these two investigators pulled this together. The lead investigator, Nayo Kwate, is a psychologist, and Dr. Melody Goodman is a biostatistician. And I'm really excited that they brought this paper together under the umbrella of social epi, because I do think that they addressed something that social epi and epi in general feels like is important in thinking about counterfactuals, right? So they set up their analysis and their experiment so that they had these counterfactual neighborhoods of people who would experience white privilege across a certain socioeconomic gradient, ones that would experience white privilege and have high socioeconomic position compared to those who had white privilege and low socioeconomic position.
So I think that's a fantastic summary of, and I will just sort of weigh in here just a little bit just to say that I really liked the way this paper was done. I could say more about that later, but it's just it's so different from, as I said, so many of the types of studies that I'm normally reading. Dustin, what about you? What was your take on this? What was interesting to you?
Oh gosh, I think there's a lot of interesting things here. I think, as Lori said, I think one of the first things is the question. I think that we don't ask tough questions, or we ask tangentially tough questions, if that makes sense, because I think that we perceive. I think that there's a measurement issue there, and I also think there's an issue of not wanting to make people feel uncomfortable. This is just kind of Dustin Duncan's opinions, but I think that they directly asked a really difficult question, and a question that I can perceive that some people may feel uncomfortable with.
Yeah.
So I first laud them for doing that. And then secondly, doing a survey like this across multiple neighborhoods, I don't know logistically how that was done in terms of like field work, et cetera, but I can imagine that's really exceedingly difficult. So, as I have a small cohort study of, a couple hundred participants, I was imagining all the logistics behind that and getting them, et cetera. I thought that was exceedingly impressive. I have some kind of analytical other things, but I think one thing that comes to my mind is like the selection of Boston, which I do think is salient and important. But one of the first things I think about is the unique cultural norms that Boston has, and as it relates to the findings. These findings, to me, at first I read them and I was a little perplexed. I was like, that's not what I would anticipated. And then I kind of reflected a bit and I said, actually, this kind of makes sense.
Yeah.
So I'll proceed to say what my perception of Boston is, and certainly it's painted with my experience living in Boston, X years ago, et cetera. But from my perception, Boston's a pseudo-liberal city. So what that means is I think Boston really hides its racism really well, but differently. That said, it's Southern in the way whereby I think people want to believe that they are not racist or they don't discriminate against people, et cetera. And so like the finding, for example, that they are articulated as being unanticipated, but that some white residents who perceive Black families as welcoming enjoyed better health kind of made sense to me, because I think that those people don't perceive themselves as racist. So they're like, right. Oh, we're not racist, so this is great, right? But as I was reading that finding, I was thinking about Boston in particular, right? And I was thinking, I question whether this would, and to talk a little bit of epi, but I question really whether this is generalizable across like nationally and across other cities. And in particular, I would love to see this replicated across a number of cities, right? But especially places where there are different cultural norms. For example, places that are, I don't know how to frame this, so excuse me, but places that don't necessarily hide their racism or don't feel uncomfortable saying that, like, hey, COVID is not a thing, right? And racism is racism, who cares? Black people are whatever people may believe. I think that these findings may be somewhat, and it's not a criticism to the authors, but more so just helping us think through the question. I think these findings are probably unique to Boston and or like the social norms of a given city in particular. But I really love the authors for the strong analysis approach. I agree with everything that Dr. Dean said in terms of and everything. But I also think, as I'm assuming students will listen and reflect on this as well, is that, I think this is a beautiful example of social epidemiology in practice, right? Because we specifically operationalize these kind of constructs that people may perceive as soft science. And literally, and I emailed someone the other day saying, oh, this is soft science. And I was like, well, this is just as hard as, physics, or my little brother's an engineering or whatever, right? And in some ways, I think that this is even harder to operationalize, right? Because we have to really convince our team and then external reviewers that actually we operationalize this construct of, for example, white privilege in these ways, and based on the theoretical and previous empirical literature.
Dr. Duncan, I felt the same way about thinking about the generalizability of these results. I grew up in central Pennsylvania, and central Pennsylvania is known for its racism, sad to say. There were still Klan marches where I lived growing up. So racism was something that my family confronted every day in very blatant ways. And I think that even saying that something like my neighbors feel that Black people are welcome, right? You would not get such high endorsement of that in areas where I grew up.
That's right.
I had issues, and my family had issues, in fact, with being told that we weren't allowed to live in certain homes. There were people who told me that I couldn't play with them because their family said that they couldn't talk to Black people. And I'm not that old. So these things are still happening, right? These things still exist. There is really blatant racism happening in many places in the country and in the world. And I agree. I wonder if they would have the same findings if they were dealing with a different group of people who weren't at a certain level of privilege. Now, granted, even though they did look across the privilege gradient, Boston is still a very high cost of living city.
Yes.
So are they still looking within a subset of people who are already very, very privileged?
I mean, this is perfect. The Dustin and Lori show. Exactly. Like I was going to say, the limited range, right? this is a certain subset of people, right? And so like these aren't necessarily privilege exists, yes, but these are higher privileged individuals, right? And so I believe in studying and thinking about like oppression across the board. I believe that who oppresses people the most are the most oppressed, right? So I imagine I would like to I'll frame it this way in terms of a new study. I would like to see this among a different subset of white individuals, particularly people who have either a broader range. I mean, I could see it in different stories in my head analytically, but either a broader range of incomes, right, in terms of the neighborhood level or individually or both, and or a lower subset of a lower income or neighborhood set of white individuals. I think that the findings will pan out as the authors anticipated. I think that these are specific to the design and really specific to Boston for sure.
I would just second all of those points. I mean, this just strikes me as something that will vary both from, as you say, across cities and other localities as well, but also within cities and within populations within cities, and Boston being a the kind of place where I think you could, as you say, repeat this study and find different things in different subsets of Boston.
That's right.
So I'm curious what you all think of this. So one of the things as a, when you're growing up and you learn about, the scientific method, you're kind of taught this idea that you come up with a theory and or competing theories, and then you say what those theories would predict, and you then test it out and you see which of your two competing theories maybe is your data more compatible with, or maybe it's just one theory and you're just comparing against. That's what you're sort of taught growing up. I find that in my work that really doesn't necessarily apply. Basically, you're sort of always testing everything against a generic null hypothesis. There either is an effect of something or there isn't. This study is actually set up the way, like, it seems to me science is supposed to work. You have these two competing theories that would both predict very different things, and then they go and collect data and find that they're, one of these theories seems to hold up better. Now, I take it with all the caveats that it may be very specific to the population, but I just find it really interesting that, this is very different from the way we are normally going about trying to understand the way phenomena work.
I actually disagree.
Oh, okay, go ahead.
I think the difference is that they're explicit about the competing hypotheses and they're explicit about what they're doing. I think that in traditional epi journals like the American Journal of Epidemiology, we have to write so parsimoniously that it's all implicit. So we may not necessarily know what the competing hypotheses are, and we're just often not explicit about it. And I think this is a really good example of being explicit about a hypothesis and the competing hypotheses. I think oftentimes in science, we have hypotheses, right? We just don't necessarily make them explicit for many reasons. Maybe we don't know, we don't want to, maybe, whatever the reasons may be. But I think this is a good, and I think Dr. Dean for choosing this article, but I think partly it's a good example of strong social epi that's like really theoretically sound, right? And theoretically based. Yeah.
No, I think you're probably right on. I think I'm really speaking of myself here, where maybe what you're saying, and I probably would agree with this, that it's really me who's not being very explicit. But I don't know that. I think that the reason I'm often not explicit is because I don't often know what my alternative is. And therefore I just don't express it very well. But you're probably right. Yeah, it's a fair point.
I was going to say, I think that some of that could also be due, again, to these authors. I mean, one, these authors are leading minds in science.
Yeah.
I mean, Dr. Goodman just was named to the American Statistical Association as a fellow, right? I mean, she's at the top. And Dr. Kwate is a psychologist. And this is something I see more in the psychology journals and the econ journals and the sociology journals, that they do very clearly specify hypothesis and what analysis they did to test it, and then a disconfirmatory test, right? And they lay out their articles and they lay out their arguments in a really, really compelling way that I think in some ways we've lost in some of our scientific journals, especially the biomedical ones, which like Dr. Duncan said, requires to be very, very pithy. and we can't actually lay out all of those arguments and all the disconfirmatory evidence. So some of it maybe is something that we need to think about for our field.
I think you're right, and I think probably I'm expressing more about myself than I am about the field in general. But I do think that that we would be better off if we were working in a way that is very similar to this. But I do agree with you. I mean, whenever I read papers from the psychological sciences, they are much more like this, where you have a theory that is well specified and you test it out. Whereas,
right.
Often in the work that I'm doing, I don't have a really good theory. I'm just, testing out whether or not, I think there's a relationship between things, hopefully in a causal way. But, I don't always specify that alternative. So I take that point.
I actually think that I think you probably do have a theory. You just don't articulate it to yourself enough.
Sure.
Quite frankly.
Sure.
And I'm only pushing on this because I feel like I'm a student, but I remember taking Nancy Krieger's class when she would really make us be so explicit about why we're studying something, and in particular be explicit about the theoretical grounding or basis and hypothesis behind their work. And so it's kind of, I wouldn't say train me, but did train me in a sense to really focus on that. But I'm absolutely sure that you have a theory. But I think that what this also speaks to, and I think this is a good perhaps teaching moment for students, is that I think that we get so caught up on methods, and I'm certainly a fan of methods, right? I'm a fan of thinking about appropriate methods for the creature's question. I'm a fan of thinking about causal inference and difficult things, like with this kind of like neighborhood-based research, randomizing neighborhoods and, like really cool things, right? My boss does some of that work and I'm excited by that. But I think that we get, I won't say too excited, but we may get excited at the method and or methods at the loss for thinking about the kind of why, the how so. I find that with my students sometimes, like, why is this even important? The students say, oh, I just want to answer this question. I'm like, but why? We're really in applied science, in that way. We're not just doing this for science sake, right?
Totally agree.
So I actually think that we as a field do have the theoretical thinking. We're just not explicit about it. And I think it may be like we're not trained to think about it enough.
I think that's exactly it. I think we don't get enough training in theory. And you mentioned Nancy Krieger, who I've talked to on another podcast about her, book on theory and how much it, reading it changed a lot of my thinking, because it just is not something that I had any training in, I think.
That's right.
Or many times we're trained in, for example, health behavior theories, right? We learn about Bandura, we learn about these other things, but we're not trained to think about things that are outside of human behavior, that are just things about the way in which the world is structured. And those are the other types of theories. Speaking of which, one of these things that this really prompted me to think about, and this goes back to all of these conversations that are happening about schools and critical race theory, is critical race theory the type of theory that we would recognize in epi, right? Would we call it a theory? Would we say it's a framework? Would we say it's something else? And, is it a theory that you try to test? I don't see it that way. I actually see it as a framework. I think it's a lens for interpreting historical events in a different way. And I think that's something that people miss when they're talking about critical race theory. I think they say, oh, if you're going to talk about slavery, that's critical race theory. That's not true. If you're going to talk about racism, it's critical race theory. That's not true either. It's about looking at historical events and thinking about the application and the undercurrent of whether or not racism was a driving force and how you interpret those events. So I see it a little bit differently than what we would traditionally call a theory in epi, and say it's a framework. And because I just don't know how I would test it in an epi study.
I think that's fair.
That's a great point.
Any last points anyone wants to raise on this article before we move on?
So I teach a course where we talk about privilege and health. And I'm very curious as to what people think about in terms of measuring privilege. In this study, they did some objective and subjective measures of social status. But again, going back to this privilege being this invisible knapsack, I'm just curious if either of you have thoughts about other ways in which we might think about measuring privilege. How do you measure something that is potentially invisible to people? Do you have any thoughts or ideas?
That's a great question.
So it's not an area that I have spent much time on.
You should have all the answers right now. I mean, I've been thinking about this for years and have come up with 0, but you should know. You should know within the next 5 seconds.
Okay, I feel like you let me off the hook there, which I appreciate. But I guess what I was going to say though is, this just strikes me as measurement in general is so hard. I mean, just measuring simple counting phenomena, just being able to count the number of events that occur, we can't do all that well. The idea that we are going to be able to really do a good job of measuring very complicated phenomena, and in phenomena that people often, certainly don't want to talk about or may not even know, what they really think or believe is so difficult. So I don't have the answer, but I think the more work on this, the better, because it is such a challenging thing to get at.
Yeah, I guess you would anticipate that I would, given my kind of initial doctoral training in social epi, but I don't focus on this topic particularly, so I similarly don't have. I'll answer the question like a professor would, which is not answering the question, but some kind of thoughts and commentary. I don't have the answer, but I think that we should. It seems to me that there's probably a myriad of ways that one could measure this, and that we should keep measuring it in different ways. And
I like that.
One thing that I was thinking about, I wasn't able to review the articles that they cited, just a time limitation. But what I would like to see is like a theoretical piece on like different ways one could potentially measure it, or like a workshop or work group, or like a what is it called? Like not a working paper, but like some type of standing document, that a consensus paper where kind of experts like Dr. Dean and others who are privileged, come together and talk about and brainstorm different ways. But I think my sense is from reading this article and just generally is that that work probably needs to be conducted and or done.
I would completely agree.
Great idea.
Okay, so let's move on to our second segment, where we're going to do things that is just a tiny bit different from the way that we normally do, because I have the privilege of being joined this episode by some really brilliant social epidemiologists, or I would consider you both social epidemiologists. I don't know if that's the category you would put yourselves in.
I would, yeah, of course.
We absolutely would. I mean, I think maybe best on the planet might be, or in the universe. Might be an even better superlative.
I'm not sure I would say I'm the best, but I like thinking about social epi.
Intergalactic.
That's funny.
There we are.
And so, we thought we'd use this as an opportunity just to talk a little bit about a particular one aspect of social epidemiology that you both have some experience with and that I don't, so that we could sort of talk a little bit about a topic that I think is starting to, I think it's gets a lot of attention, but not probably as much as it should, which is the role of neighborhoods in health, and to just really get a talk to you both about your thoughts on neighborhoods and the role of neighborhoods in health. So just to kind of start us off, I mean, and Dustin, I'll start with you, but
sure.
Can you talk to us a little bit about why we should care about neighborhoods when thinking about health, and what you think the role of neighborhoods in health is?
Okay, certainly I think I'm biased because I explicitly study neighborhoods.
Sure.
And so I genuinely believe in my personal and professional life that neighborhoods are salient and important and have an enduring impact on health and many other things. But I'll say that I'll frame it in around COVID, because I feel like I would be remiss to not recognize the worldwide COVID crisis that's happening now. And so I'm going to frame it in COVID. I think COVID has taught me and demonstrated to us that what's around us matters, literally. We were in a period there, and some of us still are in terms of being self-imposed maybe, but where we are, quote unquote, sheltering in place or limiting our geographic mobility. Yeah. Caveat, obviously, there's significant heterogeneity in how people are responding to COVID, including mandated and otherwise geographic restrictions.
Yep.
But for a period there, I would say a large swath of people, I'm keeping it intentionally broad, were limited to their homes and perhaps the immediate neighborhoods around them, right? And so literally, if you can't go to certain places, and I have friends who live in different countries where they couldn't pass the next administrative neighborhood unless they had a card or something. I'm thinking about one of my really good friends who lives in Italy, who's also a social epidemiologist. And so literally where you live determines what resources you have. quite literally, right?
Yep. Yep.
And I think that's just a good example of highlighting that what's immediately around you really can impact you, right? In terms of what you can have access to. I think a lot of times people say, oh, well, people eat a certain way because they just want to. And I think there's certainly some individual choice there. And I don't want to dismiss that, but they're also, and some of those choices are not necessarily only structural, but individual. So individual level stress, right? But I'll put on my social epi lens hat and say, like, if there's a large number of McDonald's around you, right? Then there's a social norm to eat McDonald's, perhaps, right? Then there's a ease of which and a myriad of other things. And so I say that to say, like, quite literally, I think neighborhoods really determine what we can access to. There are obviously many caveats, and we could talk about the many caveats and the measurement issues, and which I'd love to talk about. But I think it's quite clear that neighborhoods matter. I think moving forward, the part that's difficult is that I think we've done a really poor job in social epidemiology and spatial epidemiology in terms of thinking through, not being funny, but to harken back to what we talked about at the beginning, the theory, and really embracing the complexity of how an exogenous neighborhood exposure can relate to this individual level health behavior, health outcome. I don't think we do a good job at that. I think we're starting to, and I think that we need stronger theoretical. Well, I want to let Dr. Lori talk, but I think we need stronger. I need to be explicit about our theory, but we need to be more comprehensive in our theoretical approaches. And certainly, there are so many methodological challenges that I think that we're only now beginning to address. And there's so many which we can talk about. But yeah.
Yeah. And Lori, what about you? What for you is the reason why you think it's so important to put our resources into studying the effects of neighborhoods on health?
Similar to what Dustin was saying, I think that so much of what we think about in terms of our science has been about a very discrete exposure, right? But the world is so much more complex than that. And as Dustin was saying, the choices that we make are actually constrained by our surroundings, right? You can only do as much as is around you. And I think that's one of the key things that makes it important to understand neighborhoods. If we really want to understand why we see the health outcomes, why we see the health behaviors that we see, we can't just look at the individuals because the individual doesn't really tell us enough about what's happening. I'd also say that, and I think the paper that we just read really, really showcases this and even talks more about why neighborhood context is so important. Our neighborhoods actually are a reflection of something about us that maybe is not as easy to measure as something you might ask, right? In this place, they use neighborhoods to talk about someone's relative privilege and relative standing, right? That might not be something I can otherwise see or tell you about as an exposure, but we know and we've seen the studies that suggest that, for example, someone's zip code, or if you're a good epidemiologist, someone's census tract can dictate, 10 years to 15 years difference of life expectancy. Then we have to be looking at those other exposures, and we have to be willing to potentially engage and think about what additional methods that we need to understand those mechanisms.
I think those are really important points. I guess the question would then be, what do we do with the information that we're generating on neighborhoods? How do we go from identifying the causal structures by which neighborhoods play a role in health to finding ways to improve health using neighborhood as either a framework or as the unit on which we're trying to make those changes? Do you have thoughts on that, Dustin?
I mean, I think that's similar to Lori's question on, how do we measure privilege? And it's like this kind of, I won't say unanswerable question, but this just exceedingly difficult question. This may be less difficult to answer, but I think it's not clear at all. And honestly, I quite frankly feel like I don't have the training to know that answer. That said, I think it's important that we engage with communities, share our findings with communities, and get their thoughts on how to improve their own communities. I think that in science, we do a really good job, many caveats, but I think we do a really good job of science, right? So thinking about, Matt, you said a couple of things, thinking about causal inference, thinking about confounding, thinking about measurement, thinking about, the population, thinking about, all of these science type things, which I think are obviously really important, right? But I don't think we do a really good job of the so what, right? So, okay, we found these findings, and we never in science say this exists. We provide some nebulous language in this study. Maybe the cumulative evidence to date. Those kinds of things. But we don't say like the ironclad. This is the association. It's there, right? We don't do that. And I think that we don't do a good job of thinking about how our science relates to the implications of other policy. We may write, and this paper did, and many other papers do, the implications of the work, right? We may write a couple sentences and think about it. And I do think that we're thoughtful, but that's where it ends. And I think that we need to do a better job at, and these are outside my expertise, but of learning about implementation science, a better job of thinking about how we connect with policymakers after we have the science, right? Yeah, those are kind of my initial thoughts, but I think it's we and I think us as professionals, but also students need to get training in that. I really do. Or we're just going to keep doing the same thing we do, which is learning how to do science, doing science really well, and producing more science. Yep. Learning how to do science, producing science well, and then and then this cycle, which is great, right? I actually like writing papers and grants and coming up with research questions and thinking about the issues and blah blah blah. But ultimately, I don't want to just have a whole bunch of papers and I've done nothing in my life to improve someone's health, right? That's not why I became an epidemiologist. It was really to think about how to improve people's health.
I completely agree. Lori, what about you? What are your thoughts on how do we go from science to improving health?
So, Matt, I think your original question was a trap. I think it was an epi trap.
An unintentional
and the reason
one, maybe.
I think it was an epi trap because it presumed that we are coming at this from a consequentialist perspective, right?
Sure.
That we're doing it because, I guess, someone, there's a great paper, is the well-defined intervention assumption politically conservative, right? Do we have to have a well-defined intervention in order for something to be worth studying? Or do we take, I believe what people say is epistemologic.
I just want to admit, I want to admit publicly on this show that I do not know what the word means. Every time people say it,
epistemology.
Every time people say it, I smile and nod. I don't really know the definition.
I'm not even sure if I'm using the right word, but I think that's the word that people talk about, right? All that to say, right? Do we have to does there have to be a consequence for it to be worth studying? And I would argue, but no. However, I would also say that one of the reasons that I think we should study neighborhoods and why it is important is because these are things that are genuinely modifiable. I feel like so much of the work that has been done focuses on, and God bless the geneticists, we need you, right? But so much has been done on genes and other things that, from my perspective, are really probably not as easy to modify as something like someone's neighborhood or socioeconomic position. Yet all of the time, I feel like in nearly every grant application and paper I write is people say these things are not modifiable. But that's coming from the biomedical perspective. They're not modifiable by your clinician. No, they're not. But that doesn't mean that we shouldn't be studying them. And that doesn't mean they can't change or that they won't change or that they don't change. We can modify them. We just have to look outside of our traditional science, our epi science and traditional science bubble at solutions that might not be scientific solutions in order to change them.
So that sounds totally right to me. Sorry.
Can I say one thing, Matt?
Yeah. Go ahead.
Just to push that point further, Lori, which I completely 100% agree with, and I think it was so well said, is also that we have to prioritize changing them. If we believe that every neighborhood can have a park, we can create a policy. I mean, I'm making this up on the spot, but that every neighborhood, there should be a 10%, and I have no idea how this works. 10% of every neighborhood is mandated to have a park. It will be the case, right? We literally built neighborhoods. I don't think we prioritize the changes.
And solutions to public health problems are not always public health solutions, right? I think that's something to recognize, right? So building a park might not feel like the most public health solution, but so here's where I would push back a little, Dustin. I do
Okay.
think, right, though, if we are going to prioritize those things and say that funding needs to go there, I actually do think we need a very strong causal case, right? Because if we spend a lot of money making parks and in the end it was not the thing that was causally linked to, we'll say, someone's health, and we don't see improvements in health, then we've also expended resources that we didn't have to and not really solved the root problem. So that's the flip side, I would say.
I agree. I definitely think that I think that we're in agreement. I think that we need that. And I think that we do the good science. But all I think is that I think we only think about and prioritize the science, and we don't think about anything else. And I'm thinking of a student who's really great. But, when I asked the question in their proposal defense, like, why are you studying this? And pushed them on the implications, like, well, I just think it's really important. And it was just basically for the sake of studying something, as opposed to recognizing what you're studying actually has humongous public health implications.
Mm-hmm. Well, to be honest with you, I could continue talking about this for quite a long time, but we are up against time, so I'm going to have you back so we can talk about this some more. But we do need to move on to our last segment, which is our Amazing and Amusing, where we just talk about some of the things that have been interesting to us over the past weeks. Laura, do you want to go first?
Sure. Mine is not going to be epi, but it will be about public
That's
health.
probably a good thing.
Which is that I am a big fan of short television shows. There was that whole, that whole Quibi that I was like, this is great. And Quibi never worked out, but right, this idea of
Quibi
short
died
television
very
shows.
quickly.
Yeah. But I mean, right up my alley. I really like it. Sometimes I just want a mental break for a couple of minutes and want to watch something. Well, I still don't have my 5-minute TV shows because, Quibi didn't work out. But I did discover a new television show on Hulu, I believe. I think it's on Hulu, and I'm not sure the original network, called Reservation Dogs.
Mm-hmm.
And it's about this group of Native American young adults who live on a Native American reservation. And it's made by, I think it's produced by Taika Waititi, and it's cast and all of its, I think that the cast and all of the writers are Native American. And I really loved it because it just opened me up to a different group of people who I don't talk with or learn very much about otherwise. And I also like that the way that the show is set up, every episode showcases a different part of Native American life. And after the pilot episode, I think the next episode is about the public health system on Native American reservations. And I just thought, I won't spoil it, but I just thought it was really fascinating to think about what happens when you have people who are American coming from outside and bringing healthcare and health resources and doctors and clinicians and nurses who aren't part of your community into your community? And what are the tensions that arise there? And how does that play out into the type of health that you get?
Sounds like something we should all check out. I have to say, I haven't been able to watch it because it's on Hulu, and my daughter subscribes to it, and for some reason it as of 2 weeks ago started telling us that we were not old enough to watch most of the things on Hulu. I don't know why.
One, Lori, that's got a good circle. I think I watched so much TV at the initial peak of the pandemic that I almost have no interest in watching Netflix, etc. So, I mean, sometimes I do that, but I'll say the thing that's fascinating to me, and I'm not doing a lot of reading about it necessarily, but just as I think about the world, is just how COVID has played, as COVID is the biggest social experiment of our times. And I think I'm working on a project which I won't share quite yet. It'll be done soon. So I'll share it soon. But I just think it's fascinating. Everything we talk about in social epidemiology, we are seeing play out in COVID. Everything we talk about, medical mistrust, oppression, gender, neighborhoods, immigration. I mean, it's quite fascinating to me, actually. When people say, is this surprising to you in an interview? I'm like, no, it's not at all. It's playing out exactly as it should.
Yep.
So it's obviously not exciting to see, and certainly family members of mine have been impacted by COVID and friends in multiple ways. But it's interesting from a scientific perspective, and particularly from a social epi lens, to see it play out. And quite frankly, the story goes on, right? At least as of today.
Totally agree. Yep. So I'll go second. So I was really interested in this article that was in Nature which talked about, I don't know if you all saw this article about how the Dutch university system has decided to remove the impact factor from their hiring and promotion decisions, which the reason it fascinated me was because it never really occurred to me that the impact factor does play a role in hiring and promotion decisions. I mean, I don't think in the US system we do it explicitly. We do it probably much more quietly in the sense that we look at the journals that people are publishing in. And, I don't, as far as I know, at Boston University, nobody looks at the actual impact factor of the journals that you're in. But I do think people have a sense for probably the relative impact factor. But they have made the decision to completely remove it from the hiring and promotion process. Now, I believe it's a specific institution. It wasn't all Dutch universities, but it just struck me as as we start to move into trying to get a better way of valuing the different kinds of works that academics do, going beyond these measures, which I think, really don't appropriately convey the importance of the kinds of work that people do. That's right. It's really important. And so I would hope that even if we don't use it explicitly in the US systems, but we use it more covertly, that we start to think, very carefully about how we're using it and whether or not it really does play any kind of a valuable role. So I don't know. I don't know if either of you saw that one.
I didn't see that, but I have heard that at some folks' institutions for promotion, they actually do have to list their citation factor, or how on your Google Scholar profile, there's that little H factor, H index, right? You have to list your H index and those sorts of things, which I think is really misleading, right? I mean,
totally.
Yeah, it's really misleading.
The H index is a particularly weird one. I mean, let's say you want to you feel like there's this important metric that's out there. The H index itself takes no account of how long you've been publishing, how many people you published with, whether you were even played an important role. So even if you don't want to abandon the idea, it's one that seems pretty fraught.
And it's based on ideology, right? The journals that have the highest impact factor, as an example, tend to be those, to my knowledge, that tend to be most biomedically oriented.
Oh, sure.
Why is that? I mean, we're implicitly saying that matters more than, like, why is NEJM, which is obviously a great journal, why does it have a higher impact factor than social science and medicine? I think social science and medicine has some really good articles.
I think it's a point that needs to absolutely be considered in the hiring and promotion process, that we don't want to simply reward these journals that, and again, we read a lot of New England Journal articles and they provide important information, but so does, as you say, social science and medicine or lots of other fields that don't get the same kind of visibility.
That's right.
All right. What do you got? So first?
I think it kind of summarizes and brings us together. But I'm sorry, I don't think incessantly about COVID, but I just think it's fascinating. And it's not because of the spatial epi in me, but I just really have always been kind of fascinated by movement and mobility. Like, I think partly because my parents are both Caribbean immigrants, and I think about kind of how they came to this country and whatever. So it's related. What I think about a lot now is just the tension, or I'll say the salience of ideology. I'll stop there, but especially the salience of ideology as it relates to science. I just really believe that, like, it's interesting to hear how much ideology shapes everything, including when we're presented with, I'll use the word facts intentionally, when we're presented with facts, right? It's like, And I say this not calling out anyone in particular and not bringing any attention to any particular issue, although lots and lots and lots of implications there. But I do think about that a lot now. And similarly to Lori, what she said, I think was just asking people questions. I've just learned to just listen. I think in this period of life, I mean, as well, I've learned to be a better listener and to listen to people's ideologies and kind of their thoughts, because I really believe now that ideology kind of shapes everything. And I think enough people aren't receptive to different ideologies, including when facts or science back up those ideologies. which is something that I don't think I ever thought before. I thought that science, and maybe, I'm biased as a scientist, but science and facts would drive ideology. Maybe that was silly of me. But it's quite the opposite, isn't it?
I thought the same as you, and it seems to me more and more we are actually finding exactly what you say, that it is the opposite, that ideology drives your entire belief system and which facts you choose to believe.
That's exactly right. Exactly right. And and it also, for the students listening to this, it also drives the kind of question. I feel so Nancy Krieger-esque, but which is an honor, of course, because she's so great. But
she's brilliant.
Completely brilliant. But it drives the questions that we ask, the way we approach the questions, and not only that, when we get the results, how we think about the results, how we frame the results, the implications we think. I don't think I thought about it in the past, at least not so deeply. And really, I think in my personal life, hearing different family and friends, really family, conceptualize the pandemic and how they move and interact in the pandemic, right? And what people feel comfortable with and not. And ideology not meaning not a belief in science, but that could be a belief in religious systems and how religion plays into a pandemic, or, et cetera. But it's just been fascinating to me, quite frankly. And I think this is a period of my personal life where I've just done significant reflection on many things, but how people think. And I don't think that maybe I gave that enough thought before.
I think that's really cool. Well, I think that is the perfect place to end. I want to thank both of our guests, Dr. Lori Dean and Dr. Dustin Duncan, for joining me today for this conversation. That is the end of our program. If you get any feedback on this or any other episode, or you want to suggest a study or a topic for us to take on, you can tweet us at PopHealthEX, or you can tweet me at ProfMattFox, or you can tweet Don at DTheo1, or Chris at ID.Gill, or you can find us on the Population Health Exchange website at www.pophealthex.org. We want to thank Leslie Talalian, Assistant Dean of Lifelong Learning at the BU School of Public Health, for supporting the podcast, and Nick Guler for sound and editing and having the radio voice to do fantastic voiceovers. Thanks for joining us. We hope you enjoyed it, and we hope you will download our next episode.